Hello and welcome to Sostento Live. It is great to be back with you all again. I want to shout out to all my frontline health workers, Sostento staff, partners, other individuals who have joined us here today. What I'd like you to do to start, put your name, your location, and your organization in the chat so we can know that you're here. So again, welcome everybody. It's so great to be with you all again live on behalf of Sostento. And if you could, put your name, put your location, put the organization you're repping in the chat. So we are going to jump right into it because we have a full schedule today. And our Sostento Live topic last month was about preparing for the end of the public health emergency. And wouldn't you know it, the federal government, Congress, decided to end that public health emergency a month early, even though our frontline health workers are telling us that the pandemic is still here. And so we had a very timely live last month. And for this month, while there may still be a lull in cases for COVID, it's during these quiet times that you need to be thinking about preparedness. And so our topic today is to talk about pandemic preparedness. Before I do that, I want to see, I got folks shouting out in the chat. Let's see who we got. We have Rachel from our partner clinic, Ethne Health in Clarkston, Georgia. Visited them before. The most diverse square mile in America they serve there in Clarkston, Georgia for Ethne Health. We got Eileen from Sheep Health in Pittsburgh. Welcome, Eileen. We got the team from Open Arms Clinic. I know there's probably a bunch of them watching, headed up by Sarah Nichols. Sarah's been on the live stream a few times with us. Hello to the Open Arms team. We've got the Capital Medical Society Foundation in Tallahassee, Florida. That's great to see some folks from Florida joining us. I see a bunch of Sostento staff is here. What's going on? We got Virginia representing. We've got our partner, the AmerisourceBergen Foundation is here. Hi, Kate. How you doing? Great to see you. As well as Friends in Need. I know they're in Tennessee. Another clinic in Tennessee. Hey, Jessica. How you doing? As well, I see others are coming in here. Let me get one more. I see we got Laura, West Virginia, Milan Pusker Health Right Clinic. Let's see one more. Okay, we got Roots Clinic representing our featured guest day is Roots Clinic. Thank you, Annalise, for joining us from the Roots Community Health Center in Oakland. Your leader will be on here in just a moment. So welcome, everyone. Like I said, today's theme is about pandemic preparedness. And I know a little bit about this topic because in the years before I started Sostento, my work took me around the world to do pandemic preparedness and pandemic response. And let me tell you that preparedness matters. And I want to share two stories from my work around the world that will tell you why preparedness is so important. So first takes us to Uganda, Kampala, Uganda. In 2018, I hosted a week-long pandemic preparedness event. Maybe if you bring that image a little bit bigger, you can see me straight away in the middle, the tall guy right in the middle, that's me. In Uganda, it's a hot zone country, many pandemic threats lurking. And at this event, we brought together the country's Ministry of Health officials in charge of pandemic response with frontline health workers and technologists to talk about how they could more rapidly respond to a deadly threat. And we were talking about Ebola specifically. That was our main focus. So for 1 week, we lived together, we worked together, and we identified specific challenges in their pandemic response, specifically that it was taking too long to get a positive Ebola test from the community to the government. And only after a positive test could the actual response begin. And so we spent that week thinking through ways to use technology to improve process. And we tested again, how would we cut the response time for an Ebola case in the country? Last year in 2022, Uganda had one of its largest Ebola outbreaks in history, but it was ready. They had processes in place to get those tests done quickly. They had things they had learned from COVID around quarantine and making sure you had a quick response to cases and how to educate the community. And they were able to stop that outbreak in its tracks before it became a pandemic. And that was because the people in charge of the response had come together had practiced, had simulated pandemic response, had found where the weak links were, and they were ready for the response to Ebola when it came. That's one story. A second story from my time in Cambodia. I was working in Cambodia, and they were looking, how can we change our paper-based outbreak reporting system to a more efficient system? So when I went, 2013, started working, they were actually reporting outbreaks in the community, and specifically bird flu is what they were interested in. They were reporting them by paper-based to get to the main response in the central government in Phnom Penh in the capital. It was by paper. And they said, we can do better. And the government then identified this issue, and they worked with the local mobile phone network companies to launch a national disease reporting hotline called 115. That meant that anyone in the country who believed that they saw a bird flu outbreak or another kind of outbreak could actually press 115 on their phone wherever they were in the country and report it to the government. They also trained all of their health workers in the country how to use 115 to quickly report potential bird flu outbreaks. And lo and behold, what the government started to see was spikes in calls in areas where outbreaks were happening. And so instead of waiting for paper-based reporting for things to bubble up, they were getting direct reports from the community as well as health workers, and they could see literal spikes in calls to 115 when there was an outbreak threat. Because they had 115 in place, by 2015 it was fully operational. That line during COVID was deployed and was receiving 18,000 calls per week at its height. And so Cambodia and Uganda experiences tell me you do not need to wait for the next major threat to be prepared. There are things that we can do. Now, COVID was my first pandemic response work here in the United States. And I learned a lot, and specifically that in the United States, it is different than Cambodia, than Uganda, or any of the countries around the world that I had worked in. And that's because we don't have a centralized government. We have a federal government with strong state public health departments, as well as local power in city and county health departments. That is an incredible challenge. Now, early in the pandemic, they had thrown out the pandemic playbook, and so COVID response in the first few months were haphazard and chaotic, and it led to lost lives. Fortunately, in the last 2 years, we have improved testing, treatment, as well as vaccine rollout into the response. It was unprecedented, and I am very, very proud of the work that we did with the federal government, state partners, as well as the free and charitable clinics, many of which are here today. We increased access to life-saving care. Now, the federal government may have ended the emergency, but it does not mean we can let our guard down, and we have work to do. Last December, I was incredibly excited when Congress passed the Prevent Pandemics Act, a new law that provided resources for pandemic response, including among other things, a permanent pandemic czar to sit in the White House in charge of planning future response. There was budget made available, a team of up to, I believe, 25, as well as resources and support to help prepare communities. Unfortunately, nothing has been done by the White House with this act. On this live, I am calling on the Biden administration on behalf of all the frontline health workers. You have the mandate. We must be prepared. And now I know preparedness is hard. It's not easy, especially with all of the things that we have in front of us. So I'm hopeful that they will act on the Prevent Pandemics Act soon. But what I'm here to tell you today is that for Sostento, we are here to help you think about preparedness. We know the frontline health workers, you have day-to-day stress. You have people coming to your door every day that need care, and you don't have a pause button. There's everyday burden on you that may not give you time to work on pandemic preparedness. But what I would like all of the frontline health workers who are listening today, Sostento is not going to wait. We are not going to delay. We are your partner to make it easier to do pandemic preparedness. We will be working the rest of the year on pandemic preparedness. And we will be working on an emergency action plan for future threats that we will be sharing with you and asking for your participation. But here's the crux. Preparedness is not just about an emergency action plan. Preparedness is about strengthening equitable access to healthcare every single day. And that's the most important part. We don't have to wait for a pandemic to be prepared. We don't have to wait to make a difference for frontline health providers that are providing care to marginalized individuals that lack access. I believe that the access issues existed before the pandemic. They got a spotlight on them during the pandemic, and they still exist today. So here's what our approach will be. Not just an emergency action plan, but what we are thinking about is how we can help prepare you every day for what is coming to your door on a daily basis. How can we help you increase access to marginalized and hard to reach? How can we help you save lives on a daily basis? And if we are focused on that, should the next threat arrive, you will know that we can all come together, activate our emergency action plan, and save countless lives. And so today, Sostento, we are going to start our work with you on how we can think about preparedness for the next threat. We have three great frontline clinic leaders here to talk. And who I'm going to bring up onto the stage first is an inspiration and an advocate for frontline health workers. Our guest will be Dr. Abalada. She's the founder and CEO of Roots Community Health Center. If you see her on Twitter, she's a loud advocate for frontline health workers, their safety, their well-being. We worked with her clinic early in the pandemic, and I'll never forget, a few months ago, I was invited to a White House event for community COVID response, and who did I see on stage on the panel was Dr. Abalada, and she brought it in the White House, talking about the importance of community response. So let's bring her on and let's talk to her about this issue. Greetings, Dr. Abalada. How are you?
I'm doing great. How are you doing?
I'm doing wonderful. So nice to be with you here today. So I want to just start off. You're the founder and CEO of the Roots Community Health Center in Oakland. First, I want you to tell me a little bit about what inspired you. Why did you decide to start that clinic? And tell me a little bit about what services your clinic offers and what are things like today at your clinic?
Absolutely. So yeah, I was born and raised in Oakland, California. And, after going off to college and medical school and training to be a family physician, I wanted to come back home. And that's what I did. And I, was very passionate about and still am about Oakland and about our community, and worked in community health as a physician, seeing patients, mostly sick patients, one after the next, and really looking at the state of my folks in Oakland and looking at health disparities and really trying to understand how do we get ahead of these things rather than just treating disease. And so I think after a lot of exploring and researching and talking to folks who were kind of similarly concerned, we formed basically like a think tank, and really honed in on the area of East Oakland where we ultimately placed the first location of Roots. We started off as a mobile operation, volunteer operation. I was going out to facilities and seeing people. And then ultimately found the location where the need was the greatest, the disparities were greatest, and where I felt like we just had a lot to learn in order to truly serve. And so that's what we've been doing ever since. And we've grown organically from that 2-person kind of volunteer operation to now over 200 staff. We are in Oakland and San Jose, and really meeting the needs of our most marginalized community members. We provide full scope primary care for the whole life spectrum, We also have street medicine that goes out into Oakland's encampments. We have a site at the jail in the parking lot so we can meet folks when they're coming out of incarceration. We're very deep in the community. We don't stay within our four walls. We go out and we meet people where they are, literally and figuratively, and in all senses of the word. And we've been basically growing, since we were founded in 2008. And we've continued to experience a lot of growth also during the pandemic, and obviously all of the changes that has brought about as well.
Well, that must be quite a journey from 2 people to 200. Here at Sostento, I think we've gone from 2 to 20, and that was a big leap for us. So I can only imagine what the journey is like from 2 to 200 plus staff. So the first kind of question related to preparedness that we want to talk to you about are talking maybe about the changes in your clinic that you are going to be looking to continue to do, into the future. They're still in place today. What are how did COVID-19 affect your clinic, and what are these changes that you're going to be, continuing to withhold at your clinic?
I love this question because early on in the pandemic, it was like, I think the first thing that I said was like, okay, no one's coming to save us. We are going to have to we're going to have to build this for our community. And I made a commitment to our team that we wouldn't just build things for the crisis and then dismantle them, because our community and our team deserves better than that. And so that anything that we felt was important enough to invest in, we were going to be looking at how to maintain it. And I think that we're doing that. We've done that. And so some examples, it might sound simple or silly, but the outdoor clinics are, they're more than just tents and tables, right? There's a lot of infrastructure and a lot of thought and a lot of planning that goes into those. And what they really represent are visible and easily accessible points of access to care for folks who may not be already a patient of ours. And so we really opened up, our site, our location, and in that case, our parking lots, initially to testing. We stood up the very first walk-up testing site in the entire region. Most of the ones you saw were for folks with cars and computers and, algorithms and able to get spots. And we were completely walk up, very, very low barrier, and opened up to the community. And of course, we're no longer having those lines wrapped around the block. But we feel like that outdoor presence, it's safe. We are still in a pandemic, and so it's a safe way to provide testing and vaccination. But we can also add other community level health related services, and that's what we're actively working on doing. And so keeping some of that kind of accessible community level structure has been really important. And along with that, of course, are the databases that we needed, the IT, and connectivity that we needed so that we could enter things real time. Databases, because, for a lot of us, we run clinics, we weren't wanting to put everyone that we test into our electronic health records. We needed something that was separate, but that we could track what was going on, and if we were repeatedly testing people, and what their vaccination record was, and so on. So those are all things that we intend to keep and actually build upon. Definitely, we built up our IT infrastructure to support telehealth. That's something we feel very strongly has to continue. That really, really opened up access for a lot of folks. That should be continued. I think our communications platform, we still do a Tuesday morning health briefing. It's about 20 minutes, 15, 20 minutes. We've done that since July of 2020. It's kind of hard to believe that it's still going, but there's never any shortage of information that the community needs to hear in a relatable way. And so that is something that we intend to continue. And if it's about other health threats, we talk about a lot of things besides COVID there, because we've had so many other emerging things happen, Mpox and polio and just other things that have been cropping up that we want to make sure that the community stays educated and informed about. So we will continue that communication platform and not seek to dismantle it. And we found that it's become even more critical for folks now because everyone else's briefings have gone away, right? Everyone else's conversation about the pandemic has essentially gone away. And we found that it's been a really, really important tool to just get across timely information to our community. So we intend to continue that. I think there's venues that we've established where we're talking to community members maybe that we didn't before, like a group of organizations that do health communications. We never had that before, but we get to hear from one another. What are you hearing? What are you seeing? What information do we need to get out there? We have a community doctors forum that I convene, and that is something that we found incredibly valuable. We deal with not only COVID, but our community violence issues that we're facing, and other threats. And so I think all of those infrastructures are critical. And I think the last one I'll share is, safe spaces for us to gather, for community gather, for our staff to gather, and do it in a safe way. And those are actual structures that we've built. We actually purchased, a community center with specifically, the rehab in mind, ventilation, outdoor spaces, and so forth. We've created, and we want to continue to do that because, unfortunately, this is going to be with us, and we have to be responsible about how we're engaging with community and with one another.
Yeah, you talked about a lot of different things there about infrastructure that you're keeping going, communications you're keeping going, partnerships. Those are all things that resonate with me. When you think of preparedness, it's what infrastructure can I continue to build, brick by brick, little by little? What communications habits can I keep up? What partnerships do I need to strengthen? And I think my follow-up question for you here is, when, let's say, at this point, health workers are tired, we're exhausted by all this. Maybe you can talk to me a little bit about when you get tired, when you get down, hey, can I keep doing this? What keeps you going? And what do you say to your team that is feeling the way to keep them going?
Yeah, I think it's been important this entire time to kind of acknowledge the moment that we're in. And I think that has been really helpful, because right now I'm witnessing a concerning kind of rush to put it all in the rearview mirror and forget about it. And I actually think that's a mistake. And I think it's going to really hinder our ability to move forward in a healthy way. And so I think this entire time, the work is hard. The work has always been hard. Before the pandemic hit, we were dealing with a homeless crisis, mental health crisis, a gun violence crisis. None of these things have ever been easy for us. And we've never had the luxury of being able to focus on just one thing. So that has not changed. And so I think we've really been intentional about trying to create an environment for our team where it's okay not to be okay. It's okay to take a moment. I think we're trying to see how we can build in all those ways of respite, whether that is, making sure that folks who are truly, on the front line can rotate, can reach out to their, can basically lean on their coworkers and creating that environment. And so I think that's something that we've tried to do always, even before the pandemic. And that continues to be super important, because it's not like, okay, we're dealing with a problem and then we're going to be not dealing with the problem. We kind of always have to stay vigilant and focused, and that's difficult. And so, and this is why Roots was established in the first place, right? Is to address these disparities that are very longstanding and that are difficult to tackle. If it was easy, it would have been done. And so I think we're all sort of in that space where we're dealing with a lot of injustices, but things definitely, the heat got turned way up with the pandemic. Things got very difficult around us. And so I think it was very important for us at our core to stay focused and stay aligned and stay in communication, and for, the entire team to feel that we're all in it together. And it doesn't change how difficult it is and how we all still need a break sometimes. And so I think the main thing for us is keeping those communication lines open and acknowledging that we've been through a collective trauma. And when you go through a collective trauma, you don't just we all know what happens if you try to just deny that it ever happened or sweep it under the rug, even though that is like a human tendency to do that. But I think we're trying to encourage, we can't do that, because there still is work ahead. But we have each other. And I think that the power of having each other and being a group of people all pushing towards the same mission is probably the thing that keeps me the most energized and fortified through all of this.
So true. The kind of not feeling alone in this is so important. That's why, we ran monthly Zooms for our frontline health worker partners to just come play music, be with each other, share stories. That sometimes it is just about that social connection and making sure you don't feel isolated and alone. We're dealing with it. And I think the additional thing that I would add is an acknowledgement that the only way to really reduce the burden and the burnout is with resources. It's with money, it's with staff, it's with giving the health workers what they need to do their daily job. I think the social time, the camaraderie, it's what we need to survive the day. But to do our work for the community in the long term, I think the only way is to just realize the work that the frontline is doing, that in the beginning of the pandemic, they didn't even have the PPE needed to keep them safe. And I don't know if we're doing enough right now to make sure that they have the resources and the staff and the funding they need to continue to do the work. So totally resonate with your words there, especially about the need for connection among those who've been through the collective trauma and have been on the front line. So maybe you can talk to me a little bit about, what your clinic or your thoughts are around preparedness. And in particular, are there any lessons from COVID-19 response that you are specifically worrying that we're already forgetting?
Yeah, I mean, I'm worried about most of them. I'm worried that we didn't learn the lesson, because if we learned the lesson, we wouldn't forget it, right? And so I am a little bit concerned when I look around and see that there is this attempt to kind of dismantle everything, get rid of the outdoor services, pretend like it's over, and we're seeing that from a number of places, including funders and people who are supposed to be providing those resources. And so it is concerning. I really appreciate how you opened up today, in that, something I've been saying is like, let us tell you when it's over, because it's not over. And so the fact that we are having to continue on the ground, of course, demand for some of the direct services has reduced, but then the demand for others is increasing. And so as we see people, losing their benefits, as we see eviction moratoria lifted, as we see food insecurity come back with a vengeance, these are all things that we're on the ground dealing with. And so I think, having sort of this notion that it's a switch that's being flipped on and off from leaders is really concerning, and it can feel isolating, because, to your point, the resources is what is what's needed now more than ever. And to deal with, we actually had sort of a pause button pressed on a number of critical issues, like people becoming homeless and people being hungry. And now those things are unpaused again. And so I think what we're facing right now is not only, being in a continued pandemic, but kind of the resurgence of all of these things that we were dealing with prior to the pandemic. So I think, for me, it is, we need to, I think we relied a lot on all of the folks on this call, the frontline workers. We need to continue to trust. We need to listen. We need to understand that those are the folks that really know what's going on, and those are the resources that are needed. And we can't be, in a deficit trying to address all of these issues, especially when, for a lot of us, we kind of raised our, profile in the community to the point where it's like we're welcoming more and more people in without an ability to bill necessarily for those things in a commercialized pandemic response, the way that things are moving. And we don't want to raise the barriers. We never have wanted to raise the barriers. We've always been very low barrier. And so what does that look like now when, everything becomes commercialized and dependent on somebody having insurance or not? And so I think, some of the lessons on the, high level, I would say, are, for me, data is a big one. The fact that we had such, I think it took a while, but it was pieced together to the point where we had, data dashboards and things that we could look at to tell us where we are. Those are going away. It feels like every week there's one less dashboard or one less source of information. And for me, that's probably the biggest one, because we know that we're flying blind if we don't have good information. And so I feel like that was a missed opportunity. And to the extent that there is something in the background that's being created, that needs to be shared, because I think the transparency with the public, even though it is a double-edged sword sometimes, I do think for those of us on the ground doing this work, we absolutely need the information. We need to know what's going on. And so I think that that's one really important key piece. I hope that the partnerships will continue because I think that's something that is really, really valuable. And it worries me seeing that, these convenings or the monthly, sessions and things like that are going away. And people are saying, well, we're gonna stop it now. And I keep asking why, what's the objective measurement? It's not cases, it's not hospitalizations, and it's not deaths, because those have basically been the same. We're worse now than we were a year ago on all those metrics. So what's the objective reason? And most of the time there isn't one. It goes back to the emotion of wanting to put this all behind us. So I think I'm worried about a lot of the lessons, frankly, being lost here. And I think it's kind of up to all of us to continue to, I say we could show them better than we can tell them. And so we just have to continue doing it. And so I think that's something that is kind of incumbent upon all of us.
Mm-hmm. Yeah, I want to follow up with something you kind of talked about, that while the COVID services demand is going down, the demand for other services are going up. And so what advice would you give to clinical leaders that are looking to balance their daily demands of those things that are resurging, along with making sure they're putting in place key preparedness measures in case of another emergency?
Yeah, I mean, this requires the same thing that probably was required even before COVID, of us being, having our eyes wide open and really, being connected with one another and not being blindsided by things. I think one thing that does concern me is that as all of the resources for the pandemic itself go away, that our community centers need to be still be protecting one another. I think there's still the very real risk of setbacks as it relates to the pandemic itself, and that, along with everything else we're facing, feels like it could really create some critical challenges. So I think, and I really appreciated what you said about, April is our lull. It's been our lull month, every year, basically. With this pandemic. And so this is a good time, not to like throw everything out, and try to act like we're done, because we would be very wise to prepare for increases once again, in the summer, just like we've had every summer so far. And I think to not do that really could create some major setbacks that will hamper our ability to address all of those other things that I mentioned. So I think first and foremost is staying in reality about what's actually going on with the pandemic, and not falling for what I think is, an attempt to shift the narrative, because the reality has not changed. And it's our communities that will be the most impacted. Once you commercialize a response, then disparities for folks who are uninsured and underinsured will widen. We saw the exact same thing with HIV. And so we can't get kind of caught off guard with this. We really have to stay very vigilant as it relates to the public health, the pandemic. We're still in an active pandemic, and, we are still under that public health emergency of international concern. That's the highest alert the World Health Organization can issue, and it's still in effect today. So I think we need to be really kind of clear about that and understand that once the response is fully commercialized after May 11th, that it means that access to the things that will keep people out of the hospital and keep people from dying are going to become less accessible for the same communities that we care for and that have less access to everything else. So I think, eyes wide open about the pandemic itself, first and foremost. And then I think, outside of that, we're going to have to always, like we've always had to, walk and chew gum at the same time, right? We're going to have to be able to address all of the other crises that are emerging. We have a mental health crisis and a gun violence crisis. Those are very top of mind for me. And so making sure that we're trying to stay a step ahead, because most of us, we're on the ground and we can see things coming. And really staying in communication with those same public health folks. We actually were able to get gun violence declared a public health crisis in Oakland and Alameda County, and get resources allocated to that and a department set up. And I really believe a lot of it is the relationships that we strengthened during the pandemic around how we respond collectively to a public health crisis, and realizing that there's other crises that we're also having to deal with simultaneously, and really holding some accountability, I think, to all of those leaders and folks in charge, because we saw what was possible during the pandemic, right? In the Bay Area, we saw 7 public health officers get together to issue a joint, kind of order. Never saw anything like that before. Imagine if we could do that for homelessness or drug overdose or gun violence. And so I think also sort of keeping up our expectations of our leaders and not letting those fall by the wayside.
Yeah, so I think I heard, don't let our guard down. We know what disparities will be increasing with the commercialization of the COVID response. We can have our eyes wide open, and it's up to us now to be leaders, to be advocates like you are, to keep things moving forward and knowing we know what's coming. I think we know what's coming, and it's up to us now. So I think the time flew by, Dr. Abalada. So I have one last question for you. Give us something you're excited about for Roots Community Health Center in 2023. Do you have any big goals or anything else you would want to share with us about your clinic or what you'll be up to this year?
Yeah, we're continuing. I think all of the great work and continuing to lead out in several areas, including our community members that are struggling with mental health challenges, and really wanting for us to seize on the opportunity that folks are now talking about this. So I'm excited about ensuring that we all can start paying attention to our own, I think, mental well-being and that of one another. And, we still have a lot of challenges ahead of us, but I think, I'm excited about building on what we've already built during this time, continuing to kind of do more in the community, and starting to do more safe gathering. I'm super excited about that. We've started to do that again, getting all the staff back together. And getting the community back together to engage in person and in a way that feels safe and where we can really model our community care, because I think that's what that is. And so we're continuing to implement all of the things that we've learned through the pandemic. I think for me, I signed up for a lifetime of learning when I decided to be a doctor. All of us in healthcare signed up for a lifetime of learning. So a lot of this has been fascinating, and the things that we've built, we get to incorporate now. All the knowledge that we've acquired, we get to incorporate now. So I'm excited about, I think all of the awareness that has happened throughout this, and not wanting to lose that. So I'm excited and a little daunted, because I know that means continuing to raise, the level of the advocacy voice even higher and higher. But I'm excited about continuing to build with partners like you all.
Well, thank you, Dr. Abalada. We've got your Twitter on there. Must follow. Yes, I seen you on there. Our team wonders how many hours of sleep you might get a night by what you're doing there. Such a loud voice. And so thank you for joining us and inspiring some of our clinics with all that you do out there on the West Coast. So thank you for joining us today.
Thank you so much for having me.
Take care. Thank you. All right, so now we are going to have a short intermission. We're going to try something very special, new type of intermission. So what I'm actually going to do is I'm going to bring on my colleague, the Sostento Director of Partnerships, Emily Roning is here. Hi, Emily. How are you?
Hey, good. How are you doing?
I'm doing well. This is my favorite day of the month whenever we do these live events. And so what we're going to do now is Emily's going to lead us in a gratitude exercise. I'm going to take a brief break, and then we're going to come back with our clinic roundtable. So please enjoy. Emily, I'm going to give you the floor and let you take us through this gratitude exercise.
Yeah, go take a breath, Joe. Well, thanks everybody for being game for something a little bit different today. I'm Emily Roning, the Director of Partnerships here at Sostento. And like Joe said, typically the intermission is a prompt in the chat, and we all take a break and play a song. But for the next few minutes, we thought, given the topic that we're covering and have been covering for the last 3 years, we thought we would take a moment of respite. And Dr. Abalada said it well. We all deserve that. The work is hard. It's always been hard. And so today we're going to ground ourselves in some gratitude. So the meaning of Sostento, I'm sure you've heard us say this before. The meaning of Sostento, it's an Italian word. And really, it's one of those words that means many things, and it doesn't have an English translation. But really, at its core, it's meant to uplift, to nourish, and sustain. So we wanted to kind of hit on that today. So in the chat, I'd like to hear from all of you. What's uplifting you? What's nourishing you? What's sustaining you as we think about as we continue to do this tough public health work, and think about preparing for the possibility of another pandemic, what do you cling to? And so I'll give you all just a minute to put your answers in the chat, and then we'll pull some up on screen. But to get us started, I can share something that I'm really grateful for. So I'm based out of Minneapolis, Minnesota. So tough Midwesterner. We had a really long winter. And we had a bunch of snow melt in March. We had grass showing, which is early for us. And so you see a lot of leg in the Midwest in the spring. And so folks had their shorts on, there were people in sandals, everyone's out taking bike rides. And then April 1st rolled around and Mother Nature gave us a huge April Fool's joke and dumped 15 inches of snow on us. And so we had sort of, at the time, of course, it was frustrating and people had put their snowblowers away. But we got a second chance at that really, really special kind of week or two of that first taste of spring. And so I'm really grateful for that. You really only get it once typically here. And so to get it twice was kind of a gift. So let's pull up a couple comments. Amber, my kids, of course. I've got a son myself, and some days are harder than others, but absolutely so grateful. Eileen, the incredible people who volunteer and commit to the mission of the clinic. Yes, absolutely. Jenny, learning new things and growing. Jenny's a staff at Sostento. Hi, Jenny. Grateful that you're here. Ritika, something that uplifts me is the importance of our work and the impact it makes on the community. Definitely keeps me going and is my biggest motivator for pursuing a career in medicine. Ritika, yes, she is off to medical school in just a few months. So we are so grateful to her and her future plans. Diana, my dogs, and also the kids. Yes, I love that the picture of you has your kids in it. That's amazing. Open arms, our volunteers, staff, and patients. Absolutely. The core, the absolute core of why we're all here. Christine, everyone on this call and knowing how crucial you are to the communities you serve. Absolutely. I think something that I didn't mention in my intro, but to do this work in service of and in collaboration with all of you is such a moment of gratitude for Sostento every day. We feel really lucky that we are in service with you all. Alice, I'm grateful for work to bring back mask requirements in healthcare and other essential places. Wow, that's amazing. Yes. All right, let's do one more after Amberly. Amberly, our work is making a great impact on individual lives. Absolutely. Amberly is one of our program team members, and she actually worked at a clinic, a free and charitable clinic in Wisconsin. Jenny, also the picture of chihuahuas next to blueberry bagels. Okay, I don't quite know what that means, but I love it. And I will bring Joe back on. Joe.
Yes. Thank you, Emily, for walking us through. I like that break, filling things with gratitude. And what I'm gratitude for right now, very gracious for, is when I leave the office around 5:30 or 6, it is still light out.
Yes.
I'm very grateful for that sunlight, for that opportunity to take some steps and enjoy that sunlight. So
it's
that's what
such a simple thing, but it's huge. Well, thank you for having me, and thanks for being game to do something different.
Yes, and let's get one more on there while we're here. We got Amelia, another one from our team here. In the Equitable Vaccination Network, all the clinics, they didn't know where we would be without their resilience. Also, dog. Who doesn't love dogs? Yeah, I mean, I think mostly dog lovers. I bet there's some cat lovers as well in the audience. So thank you, everyone, for sharing, and thank you, Emily, for coming on and helping us through that break in the action. Okay, well, without further ado, we're going to spend our last about 20 minutes here talking with two free and charitable clinic leaders. This is the group we've worked with exclusively almost during the pandemic. We've worked with some other groups, but our main effort has been with free and charitable clinics. There's 1,200 of them across the country. They treat nearly 3 million people annually, and they don't have the same support as a private or public health provider, like an FQHC has, yet their services are more important than ever. So these clinics, along with their regional state associations we also work with, are tireless advocates. They are working to get equitable healthcare access, and I'm proud to have worked with them throughout the pandemic. And today on our roundtable, let's bring them up. We have two leaders. We are going to have Brianna Lathrop, who leads the Good Samaritan Health Center in Atlanta. And we are going to have Liquat Khawaja, who works at the Ibn Sina Foundation, a large free and charitable clinic with multiple locations in the Houston area. I am proud to have supported these two individuals and worked side by side with them during the pandemic. They've showed grit, they've showed courage, and they showed commitment to their communities in the face of great challenges. So without further ado, let's bring them on. Hello, welcome Brianna, welcome Liquat. How are you today?
Great, thank you very much. Thank you for having us. Yeah.
Thank you,
Brianna.
Joe.
It's great to see you both. Two clinics that we got to work with early in the pandemic. We've continued to support throughout. And so I'm going to start just quick introductions. I'll go to Brianna, you first, and then to Liquat. Just can you tell me a little bit about your clinic and about your role at the clinic? And then we'll get into some questions about preparedness. So Brianna, over to you first.
Yes, great to see everybody and join with Sostento. We are always really excited to partner with you. But I'm at the Good Samaritan Health Center in Atlanta, Georgia. We provide medical services, mental health services, dental services. We have a gym, we have a farm and a daily farmers market, as well as a host of social services to support health equity work in our community. We are celebrating our 25th year anniversary this year, which is really exciting. And I've been at the clinic for 13 years now. I'm the chief operating officer, and I get the true privilege and joy of spending about half my time in direct patient care.
Awesome. Thank you, Brianna. And Brianna is the first clinic that we worked with during the pandemic and led to many, many more. So thank you, Brianna, for always leading the way. So let's bring on Liquat. Liquat, tell me a little bit about your clinic and your role at the clinic.
Well, hi. Thank you. First of all, again, thank you for having us. So we have a nonprofit community clinic. This is one of the leading clinics in the state of Texas. And we are serving 85,000 patient visits annually. This has the 7 different community locations. We are providing medical services, dental services, immunization, children's services, as well as the mental health services. And right now we are working and on the right path, that is to make sure that we have all these services integrated, especially the integrated behavioral health. And as we all know, that COVID has created that challenge that mental health burden has been increased. So we have to make sure that whosoever walks into the doors of the clinic, we provide the entire scope of the preventive and primary care services from this. This is my 9th year working for this clinic, and I'm happy to be part of this clinic since this gives you satisfaction of the community service.
Thank you, Liquat. Let's keep you up on the stage. We'll give you the first question, then we'll come back to Brianna. So can you tell me, Liquat, what are some of the practices that your clinic will be continuing and making sure that you can continue to offer around COVID-19 that maybe you started early in the pandemic, but now you are going to be turning them into long-term practices and policies and procedures at your clinic? Can you tell us a little bit about that?
Yeah, so see, before the COVID, we did not have many practices which we have created after the COVID. Like the first thing that, many clinics after the COVID, they closed their doors, even the private practices. So we never closed our doors. We wanted to make sure that the community members have the access to the clinic. And we were not aware about the telehealth model. We were not practicing the telehealth model. So we created that model, and it was not us, but it was promoted by many other clinics. So once we created that policy, and we are right now continuing that telehealth model to make sure that there are many patients who are sitting at home. They do not have the transportation. They have the transportation challenge, and they can get their medication refill through the telehealth, right? So we are continuing that model, and we are also continuing to educate the community from our lobbies, from our different marketing activities, from our outreach events, to make sure that we continue our education about the COVID and the importance of having social distancing, having all the practices which we have created after the COVID pandemic. So telehealth is number one. the education part is number two, which I believe that we will continue providing that, and that will have a lasting impact on the clinic's activities as well. But besides that, there are many other activities. Those are not as a policy, but that those activities will be a continuous part of the clinical practices and procedures.
No, thank you, Laquat. So the first thing I heard you say is that you kept your doors open during the COVID pandemic, and you will continue to have a plan should a threat come that you will not be closing your doors. So I think that's a good mindset to start with, is that there may be more unexpected things to come, but you will plan to keep your doors open. You talked about telehealth. Telehealth is something we did not do before the pandemic. It is something we should continue to do to be able to provide services, to be able to support patients in the case of emergency. We might not be able to have them come to the clinic, but we can now care for them. We have new things that we need to keep up to be able to do it through telehealth. You talked about education and outreach. I think that's keeping up the profile, that's keeping up the community presence to know that in the case of an emergency, where to come to get that education and to get that information. So I like that, Laquat. I'm going to bring Brianna now, and I'm going to ask her the same question. Brianna, talk to me about the things that your clinic are continuing to do, you're continuing to think about, even with the emergency being over. Tell us about what's going on at your clinic.
Absolutely. I kind of think of it in two groups. One is, what do we still have to do because COVID isn't gone? And especially as less organizations and other resources continue to not be available for our community, how do we step up? And then secondly, what are some of the larger problems that we developed solutions for that can continue to be solutions? So in terms of COVID, we're still testing. We're still making sure that people who are sick can get sick visits, which surprisingly is still a challenge 3 years into this, that people say, I called and I was sick and I couldn't get seen in my usual place of care. Continuing to be an ongoing site for vaccination, continuing to be one of the only places people go in the world where they still put on a mask to come inside the door. Best practices around triage between sick and well patients, offering that fast triage at the door to make sure people are routed and getting the services they need. And then second, I think a lot about what are some of the programs that we put in place. Telehealth is certainly one of them. I echo that. But another one for us was the Uber rides. We found that Uber rides weren't just needed for vaccines. They were needed for people that transportation was a significant barrier on getting to the clinic. And so as a result, we now have a robust both fundraising strategy and policy around how Uber rides are now a permanent feature for making sure patients can get to the clinic. And so I think that as I think about, moving onward, it's this balancing of what does our community need to be safe in a reality where COVID's not gone? And then where did we succeed in eliminating some of those healthcare barriers in new ways? And how do we make sure that those tools, telehealth, transportation, we significantly increased our case management services, food distribution strategies from our farm, that many of those are staying onward because their impact goes beyond just benefiting people during a pandemic.
So I think one thing I would echo that both you and Laquat said, which is it's about keeping certain services going, that there are certain new types of services. We talked about telehealth. You've talked about also as well some of these Uber rides. You should keep them going for COVID, but these are breakthroughs on health access. These are breakthroughs in reducing health disparities. And the question now is, how can we keep them going and apply them to other health areas? And I would bring that back to kind of my opening statement where I talked about how we can focus on everyday health equity and access, and that combined with an emergency action plan, knowing that in case of emergency, we're going to get together. This is what we're going to do. That if we combine keeping breakthroughs and services going, and we can be resilient to offer them and have that emergency action plan, we can both prepare to save lives in the case of emergency, but also do them on a daily basis. So then, Brianna, I'll follow up with you first on this. Are there any practices or things that you're worried that are being forgotten right now, or if you had the time and the money you would want to do, but you're unable to do right now?
Sure. I think a few things that just haven't come up yet in today's discussion are that one of the pieces that came out of the pandemic that was so unique was the way in which some of the larger funding resources, be it HRSA grants, large donors, suddenly had a lot of money and really didn't know how to use it to benefit their communities. And one of the big success stories, I think, was that the free and charitable community said, oh, we can use your resources. We have structures in place, we have connections within partnerships and within our communities that we are ready and we are mobilizing without the resources. And if you bring us the resources, we can do that even more. But I think that we can do that even when it's not a pandemic. And I hope that those funders are still listening and that there will be continued opportunities to say, small clinics across the country that are diverse but closest to the people in need are difficult to fund, and that you can't just hand one clinic $1 million. You can't over here in case anyone's listening, but in general, that there may not be the infrastructure that there is for some of those larger organizations that can receive large amount of money and turn that around, but that we found out that we could do it through partnerships, and that we were really effective in using those resources. And so that's something I'm really hoping continues. Along that line as well, that I thought there was a really unique switch in that as I showed up to a lot of meeting spaces that weren't necessarily with frontline workers, but were with people who were either funding decision makers or policy decision makers, there was a lot of interest in what are the downstream impacts of these decisions, or what's happening at the ground level. I was never asked to come on more meetings than I was during the heat of the pandemic because people needed that information. But they also need that information for other public health crises, including ones that are not new. And I think that, I started to joke with people that, I would often jump on these Zooms between seeing patients with COVID. So I'd be in scrubs, taking off the N95, my hair's a wreck, I've got the lines on my face, but it was kind of no one was going to mess with you, right? And it gave me a lot of boldness to kind of say the reality of what was going on and be less worried about, oh, what if that group doesn't like us, or what if they think this is too edgy. And for me, it was a personal learning moment of this can't change. This type of momentum and this type of, hey, we all need feedback. I need feedback from my patients to be a better provider. Our clinic needs better feedback from our community to show up and do the right thing. And then the people making the policies decisions, the people writing the larger checks, they need feedback on what makes sense and how to best use these resources. And I hope that we continue with that kind of approach of honesty and good feedback towards one another so that we can make more progress on our shared goals.
Well, Brianna, I hope you don't lose this advocacy, this voice, this boldness. You talked about one thing I would resonate with, that funders did things that they said were never possible during the pandemic. Mm-hmm. The flexibility and unrestricted funding was amazing. And I would say that if funders are out there and listening, it's not just about what's my next thing. It's how can you make these important unrestricted funding investments into free and charitable clinics. I think free and charitable clinics, I didn't know much about them before the pandemic, but now I know how important they are to making sure those that are essential workers, that are uninsured for whatever reason, that we can't have public health unless the public has health. And this is what the free and charitable clinics are offering. And I think you've added one that I would say to my list is, what are the funding mechanisms and how can we get routine resources to the clinic? Because we did a lot of work just to get federal funding out to the free and charitable clinics. We did a huge project and it was not simple, it was not easy because it was just not set up for that. And so, Laquan, I want you to come on and talk about, again, with your clinic, what are things that are you worrying about are being forgotten? You want to make sure continue to be implemented in the months and years ahead.
So I generally feel that we all have that now mindset that this pandemic is being forgotten, right? But I feel there is still a threat, right? We have to make sure that we have the policies, we have the procedures, which has a long-lasting impact. Those the testing methodology, for example, that was changed. That may we forget that right now, but the PCR methodology has a new way of testing the new viruses and anything. So I think that we may forget this for long time for this time, but this will have a long-lasting impact in the future. We have also forgotten to continue the education. For example, there have been a lot of funding. We have started promoting and providing the vaccinations, but right now, since each and everyone has forgotten that, now we are in the back stage and the back foot and not promoting those educational. As I mentioned earlier, that education, continuous education on this pandemic and on these levels is extremely important, and we shall not forget that. And besides that, the practices which clinics have developed, they may forget. There are social distancing and the mask policy. There are the policies of making sure that these patients who are coming inside the clinic, they do not have the interaction with other patients or other systems within the clinics that will affect them. And we have to make sure that, okay, these we do not forget. We shall continue providing services in a way that continue education, providing services in a safe and secure environment for all the patients. And we are serving patients who are mostly underserved, under resourced. They do not have the many social determinants of health make those hindrances for these patients to come to the clinic. So it is important for us that the population which we are serving, our community clinics are serving, they shall be more vigilant and more focused on providing the right services and resources for that community.
Yeah, I think you gave kind of like the compliment to Brianna talking about continuing to have bold, strong voices, and you're talking about being proactive in the community, proactive with our education, that when things are quiet, when it's time for preparedness, it's not necessarily time to fully let up on the gas, but it is time to get ahead, to be proactive. And I think it's a really good message for any clinic leader that is trying to think, well, how am I going to think about preparedness? It's about being proactive. It's about continuing to raise your voice. So we're a little bit of overtime here. So I'm going to get one more question to both of you because I want to respect your time. I'm sure you have a lot to do. So what advice would you give to a free and charitable clinic leader that's trying to be prepared as possible while dealing with the daily demand? So Brianna, we'll go to you first. Then we'll go to you, or Laquat, you're up. Nope, Brianna, that's fine. Brianna, you first. What advice do you give to other clinic leaders around preparedness while balancing daily demands?
Yes, I think that the first thing that pops into my mind is having a plan for mobilization, because most of our clinics are relatively small in the healthcare world, meaning that responding means bringing on new staff or changing staff roles, and that we have a lot of that in place because we've done it. I know for me, one example that stands out is that Atlanta was one of the kind of early epicenter kind of hubs of Mpox, which certainly didn't become a COVID-19 for us at our clinic. But I remember one night being like, I need a policy from the moment someone walks in the door to the moment they leave, and where the sample has to go and who picks it up and what's the phone number. Over the course of a few hours, I pulled out a series of COVID protocols that had taken me months of development. And by the next morning, we had our Mpox response plan. And it was a moment of realizing how much we had learned as an organization, and that those tools need to stay accessible and that they need to be passed down to whoever's in leadership, to everyone. And I think the second piece that I have found to be really important is the ongoing engagement of staff, and for clinics as well, your volunteers. That I think if we did one thing right in the pandemic, and I can list a whole lot of mistakes, but I think if I think of our organization, one thing we did well is that we constantly ask staff, what are you feeling? What's important? What's working? What's not? And some of that we did intentionally, and some of that we just did out of desperation because no one else had a policy. So we had to make our own. But I actually found that we did better work, and people stuck with us in a situation where I never imagined that they would. And so I'm trying to carry that into whether it's just our next strategic plan, or whether it's decisions related to COVID, is this idea that the more we share how we feel, how we experienced that, what we learned, what was uncomfortable, what was done well, the better we build that into ongoing practices. And when our internal practices feel more equitable and collaborative, then we do a better job of responding no matter what comes our way.
Love it. All right, Laquat, you're up. Bring us home. What advice would you give to other clinic leaders?
I know that many clinics have already developed that emergency plan, as Brianna has mentioned, which is again, I may have developed our own plan. There are clinics, they have developed their own plans. Right now, I think the advice is this, that an organization like Sostento can create a comprehensive plan for these clinics, which can be uh, a booklet for entire country, that okay, this is the model which you can, this is the plan which you can use. Also, we have to think that how in such situation, first of all, we would not love that such thing happen again to us, but if we have to be ready, kind of public health emergency can happen. So we have to support each other. That way we have each other's back. The way we have, I'm sure that there are many organizations, they have developed partnerships, so we have to develop those partnership relationship between our clinics, between different institutions, between the community organizations. There are community leaders, they were ready to help, but they did not have the platform how they can help the community. So we have to see how we can extend our relationship with those community leaders, organizations, and and provide the comprehensive care to those members who are either underserved, especially those who do not have any insurance that they can take and get the service. So I'm sure that many clinics are now ready to face any such challenge which will happen, but hopefully that will not happen. Yeah.
Well, I think that's a good note to end on. Partnership, if we combine our voices, they're going to be a lot louder than if we did them alone. So I want to thank you, Brianna. Thank you, Laquad, for your time, for continuing to be amazing leaders in your communities and for the free and channel clinic communities. Sostento will be here for you. Like you said, Laquad, we will be supporting you every step of the way. So thank you both.
Thank you. Thank you very much.
All right, we are coming here to the end. It's been wonderful. Thank you, everyone, for joining who stayed on till the end. I want to let the audience know that Sostento will be continuing with our live stream series in June. The next event will be Tuesday, June 13th at 1 p.m. Eastern. It will be a celebration of Sostento's work delivering over 10,000 free Uber health rides to free and charitable clinics for access to healthcare. We're going to have a special announcement at that event, so please show up for not just to learn about how these Uber Health rides work, how we reach 10,000 of them across the country, but also a special announcement about our free Uber Health rides program. So be on the lookout in the upcoming weeks for a follow-up email, also with a recording of today's event, as well as invitations for our next webinar. So I want to thank everybody for tuning in, and I hope to see you at the next one. All right. Bye, everybody.